Which of the following analgesics is available in lollipop form? A. Hydrocodone. B. Oxycodone. C. Tramadol. D. Fentanyl. The answer is D. Fentanyl. Fentanyl citrate comes in solid form on a stick, often referred to as a fentanyl lollipop. This form is 8,100 times more potent than morphine and intended for use by cancer patients and patients that have become tolerant to opioids. Celecoxib is what class of drug? A. Muscle relaxant. B. Narcotic. C. Nonsteroidal anti-inflammatory drug, NSAID. D. Corticosteroid. The answer is C. Nonsteroidal anti-inflammatory drug, NSAID. Celecoxib is a nonsteroidal anti-inflammatory drug, NSAID. These drugs work by inhibiting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, which reduces the synthesis of pro-inflammatory prostaglandins and thromboxane. Which of the following is an antidote to opioid overdose? A. Naloxone. B. Flumazenil. C. Inositolcysteine. D. Glucagon. The answer is A. Naloxone. Naloxone antidotes opioid overdose by competitively binding to mu-opioid receptors. Flumazenil is an antidote to benzodiazepines. Glucagon is an antidote for beta-blocker overdose. Inositolcysteine is an antidote for acetaminophen. Which of the following over-the-counter analgesics is one of the most common causes of liver failure in the United States? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. The answer is A. Acetaminophen. Acetaminophen in doses over 3,000 mg per day can result in significant liver damage or liver failure. From 1998 to 2003, acetaminophen was the leading cause of acute liver failure in the United States. According to a population-based report in 2007, there are an estimated 1,600 cases of acute liver failure in the United States every year, with acetaminophen being the most common etiology. Levodopa is not generally given alone due to what side effects? A. Nausea, vomiting, and anorexia. B. Delirium. C. Heart palpitations. D. Tremor. The answer is A. Nausea, vomiting, and anorexia. Levodopa, L-Dopa, a common treatment for Parkinson's disease, is generally given in combination with carbidopa or another peripheral dopa decarboxylase inhibitor. This is because levodopa alone will stimulate dopamine receptors in the GI tract and the chemotrigger receptor zone, CTZ, in the brain, resulting in nausea, vomiting and anorexia. A peripheral dopa decarboxylase inhibitor prevents levodopa from being prematurely converted into dopamine in the adrenal glands or other peripheral tissues. How does adalimumab function to reduce inflammation in rheumatoid arthritis? A. Cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, inhibitor. B. Tumor necrosis factor alpha inhibitor. C. Monoclonal antibody. D. More than one of these. The answer is D. More than one of these. Adalimumab is a tumor necrosis factor alpha, TNF-alpha, inhibitor. This class of drugs suppresses response to TNF-alpha, a potent pro-inflammatory cytokine. Inhibition of folic acid metabolism is the method of action of methotrexate. Reversible inhibition of COX-1 and COX-2 is the mechanism of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Rheumatoid arthritis drugs such as rituximab, and almost all drugs that end in mab, including adalimumab, function as monoclonal antibodies. Which of the following analgesic medications should be used with caution in patients with hepatic disease? A. Acetaminophen. B. Ibuprofen. C. Ketorolac. D. Meloxicam. E. Naproxen. The answer is A. Acetaminophen. Acetaminophen, also known as Tylenol, is initially metabolized into a hepatotoxic intermediate. It transiently becomes a reactive oxygen species, which can cause liver hepatotoxicity. As such, in patients who already have pre-existing liver disease who are already more prone to liver injury from substances and diseases that affect the liver, it is prudent to avoid medications like acetaminophen that have a known potential to cause liver damage. Meloxicam, ibuprofen, naproxen, and ketorolac are all examples of NSAIDs. These medications have the potential to cause renal damage or gastrointestinal damage if used in excess, but do not have the known hepatotoxic properties that acetaminophen does. You are the nurse taking care of a patient who is started on a 2-week course of oral prednisone. Which of the following is a known side effect of oral steroids? A. Hypotension. B. Hyponatremia. C. Insomnia. D. Decreased appetite. E. Hyperkalemia. The answer is C. Insomnia. The correct answer is insomnia, as steroids are known to increase patients' vigilance and energy levels, thereby frequently making it difficult for patients to fall asleep and/or stay asleep while taking their steroid medication. The other choices are incorrect. Decreased appetite is not a side effect of taking steroid medications. Patients on steroids often have increased appetite. Hyponatremia and hyperkalemia both are not side effects of taking steroid medications. Hypernatremia and hypokalemia are more common side effects of steroids. Hypertension, rather than hypotension, is a known side effect of steroid use. You are the nurse taking care of a patient with severe lower back pain. He is being treated with oxycodone and hydromorphone. Which of the following analgesic medications produces dilated pupils? A. Mepridine. B. Morphine. C. Hydromorphone. D. Acetaminophen. E. Oxycodone. The answer is A. Mepridine. Mepridine, a potent opiate analgesic, also known as Demerol, is one of the only opioids that produces dilated pupils, rather than constricted, pinpoint pupils. A way to remember this is to remember the phrase, Demerol dilates. The other choices are incorrect. Acetaminophen has no known effect on pupil size. Morphine, oxycodone, and hydromorphone, all opiate analgesics, are known to constrict the pupils. Demerol dilates. Demerol dilates. Demerol dilates. You are the nurse taking care of a patient who is hospitalized for severe lower back pain. The patient also has a medical history significant for multiple gastrointestinal bleeds and peptic ulcer disease. Which of the following medications should be used with extreme caution in this patient given his medical history? A. Oxycodone. B. Morphine. C. Hydromorphone. D. NSAIDs. E. Acetaminophen. The answer is D. NSAIDs. This is the correct answer because NSAIDs are known to be irritants of the gastrointestinal tract, and prolonged and/or extensive use of NSAIDs can increase the risk of developing gastrointestinal ulcers, as well as consequent gastrointestinal bleeds in the setting of ulcers. NSAIDs reduce the production of the hormone prostaglandin. One of the things prostaglandin does is increase the production of gastric, stomach, mucus and substances that neutralize stomach acid. If there is too little prostaglandin, the stomach lining becomes more susceptible to damage from stomach acid. The other choices are incorrect. Acetaminophen is not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. Morphine, oxycodone, and hydromorphone are all opiate analgesics and are not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation.